UKIP spokesperson Gareth Bennett.
A couple of weeks ago in the Assembly, I met with representatives from the Alzheimer's Society. During this meeting, I and some of my staff undertook a training and skills session to become dementia friends. The object of becoming a dementia friend is to learn some of the logistics of dementia, what dementia is, what causes it, what are the symptoms, and most importantly, it's designed to demonstrate how we can help people with dementia by better understanding their condition. Cabinet Secretary, could you give us an update on how the Welsh Government is helping to encourage more people to become dementia friendly?
I'm happy to confirm that we work very well with a range of third sector organisations, including those people promoting Dementia Friends. I've met with Boots, for example, who, because of the leadership in Wales, every Boots store in Wales have Dementia Friends in their staff, and they're looking to roll that out in the rest of the Boots company in other parts of the United Kingdom. And actually, there are, I think, lots of people in this room have undertaken the Dementia Friends training. I have, as have my staff. And I believe that Jane Brighton had indicated she wanted to try and encourage all of us to become dementia friends, so we could say we're the first legislature in the world that is fully dementia friendly. So there's much that we're doing to promote that campaign being run by one third sector organisation. It's part of actually becoming a dementia friendly nation, which of course is spelled out in the Welsh Government's Dementia Action Plan.
Yes, thanks for that answer, and that's encouraging to hear. Problems can be caused when people with dementia have to go into hospital, particularly if staff are not trained to meet the needs of those patients. What is the Welsh Government doing to ensure hospital staff at all levels understand how to care for and support people with dementia?
As the member for Caerphilly will know, I launched the Good Work training toolkit in Ysbyty Ystrad Fawr more than a year ago, and that's been developed by staff within the service working with the third sector so that we do understand the training needs of staff to provide that genuinely person-centred care for people with dementia, to understand what matters to them, to understand how being in an unfamiliar place for most people can be unsettling, but particularly for people who have dementia. So it is absolutely part of where we are within the health service, as part of the health contribution to the Dementia Action Plan that we have. But most importantly, I think, that is being overseen, that whole action plan, not just the training for staff. There is genuine engagement of people who are living with dementia in an oversight group for the plans. It won't simply be a report back from a minister, whether it's me or somebody else in the future. You'll have the assurance of people living with dementia giving an honest assessment of where we are in taking forward the commitments we make in that plan. And of course, we do have a midpoint review where the public and indeed members of this place can look at what progress we have made and what more we will still, of course, need to do.
There can be an additional problem, apart from what we've discussed so far, and that's the problem of stigma surrounding the condition of dementia. Can the Welsh Government do anything to help reduce this stigma surrounding the condition?
I think this conversation, the conversation we've had and regularly have within this place and around it, is part of dealing with that stigma. For people to recognise that more and more people have dementia and will do in the future. It is a societal-wide challenge and not something that people need to feel ashamed about at all. The stigma, though, often comes from people not wanting to acknowledge that they have the condition and their families and carers not always wanting to. And that's difficult because if you see someone's personality changing in particular, whether that's about a loss of memory or other changes that sometimes happen, because the dementia affects different people in different ways. It's, if you like, a basket of potential conditions and outcomes. It can be difficult to accept that person, who you know and who you love, is somebody different in who they are and how they behave. Even if they're still the same person that has brought you up, that has loved you and cared for you, and it's very difficult. And I know that there are people in this chamber who have gone through that experience, and outside as well. So this is a genuine cross-party and cross-society campaign for decency and dignity and having better outcomes for people living with dementia, and of course the research we will want to undertake to try and improve outcomes and, if at all possible, prevent dementia taking place in the first place. And in that, as in so many other things, we can do more ourselves to make choices to mean that we are less likely to have dementia ourselves in the future.